the right to health is a human right, which means that all human beings should be having access to health care.
You can see that there's always this critical link between foreign policy and policy around the globe and health. And I think Ebola in this specific instance really points out that we're all together in these global issues, particularly health issues and transmittable issues and issues that travel around the globe as fast as an airline. So it's exciting to have the opportunity to speak about relevant health issues in a foreign policy forum, because health people talk to health people and foreign policy people speak to foreign policy people, and it's that cross-fertilization and dialogue that's really critical for a comprehensive response. This really is an opportunity for us to come together as a globe around global health security, because that is the big issue confronting all of us with infectious diseases.
The government has an important role because the biggest enemy of Ebola is panic. Panic in the public opinion in rich countries, in the West, in Europe.
On Ebola, you have different aspects to it. First of all, you have the emergency answer. And this, not just with the World Bank or the UN or WHO or any bilateral donor, it's about coordinating the support that we need to provide to the three economies and to prepare the region if something worse happens. Second, we also need to prepare for the long term, which is about preparing countries to react if something like this happens again, as well as to help this country rebuild. Because on the one hand, you have the health impact, the tragic death toll, which is not over, unfortunately. But even more importantly, possibly, from an economic perspective, is the factor, the fear factor, the aversion factor, which is developing. And as usual, it was true with the SARS, it was true with the H1N1. The problem every time is that people are scared. And when you're scared, you shut down borders, you stop communicating, you stop trading, etc. And the impact can be huge. We have tried to assess a potential impact if things turn bad. For the region, it could be up to $32 billion.
When it comes to the Ebola crisis, I think Senegal learned from, as I said, the experience from HIV/AIDS. Right from the beginning, there were very strong measures that were taken. The health personnel is an important piece of the puzzle. They were also trained how to protect themselves, how to protect their families. And as you know, we had one case and it was cured. So we hope that the strategy will continue to work.
As Last Mile Health, we've been working in the rural stretches in the rainforest of southeastern Liberia for over a decade. So we've seen the power of having NGOs that can support and align behind the government's plan to bring healthcare to its rural people. What is needed if we're going to increase the number of people who have access to treatment to the 70%, or I hope more, figure, those who have Ebola that need access to treatment, having the bricks and mortar in one place in the urban towns isn't going to be enough. Having village health workers out in the remote villages who can find people who are sick, who can get them into care through an ambulance system, that is desperately needed right now. And a lot of NGOs, both international and local ones, are willing to step up on that fight.
One of the areas of strength in the multinational response to Ebola is that we finally got the alarm sounded. People now know that this is not a problem that can be contained in one country or three. There are, of course, shortcomings, and you'll hear a lot about, well, why didn't we get moving faster enough? What was the failure? And I won't dwell on that, but I will say we still have a long way to go to move from pledges to disbursements to the third D, delivery. Because delivery needs to happen, that is delivery of prevention, which includes isolation, and care, which includes identifying the sick early and taking good care of them. We got a long way to go still. I mean, that is going to require a lot more healthcare providers, a lot more laboratory capacity, and more infrastructure. We got to use this moment, seize this moment to rebuild or build, afresh a proper healthcare system, and that can be done. We've got, the governments of these countries all want to move that forward, and so let's have the multinational partners, be committed to linking our emergency response to this longer-term, effort to strengthen health systems.